health promotion. However, there's been growing interest in ensuring a more holistic approach to thematic work and developing more strategic and cross-cutting health-promoting campus programmes. As your Healthy Campus Charter and Framework document makes clear, while research is still limited, there is a growing evidence base drawn from the education sector to suggest that complex, comprehensive, multi-component whole system approaches are more likely to students, staff and the organisation as a whole. If the frogs in a pond behave strangely, our first reaction would not be to punish them or treat them. Instinctively, we'd wonder what was going on in the pond. And for me, that engagingly explains what the Healthy Settings approach is about. Its focus is not primarily about medical treatment or individual behaviour change and what often becomes victim blaming, but rather how can we modify the contexts and environments in which people live and make choices so that they actively support well-being. There's a strong tendency to equate health promotion with individual responsibility and self-help. The Healthy Settings approach, however, emphasises that individual and community action must be underpinned and supported by wider cross-sector policy, organisation development and advocacy for change. Consequently, as I said earlier, the promotion of health and well-being should quite legitimately focus on areas that may be uncomfortable or be seen to be out with. And in turn, I think we know that a commitment to an investment in health and well-being can impact positively on key priorities and enablers such as achievement, performance, productivity and reputation. Second, this shift towards a holistic and systemic model of working makes it enormously challenging to build evidence of effectiveness. It's much easier to evaluate a discrete health promotion intervention than to capture the added value of a whole system healthy campus programme, comprising as it does multiple interconnected activities and components in the context of long-term organisation development and culture change. I think if we're to move beyond delivering fragmented health promotion interventions to instead implement and reap the opportunities offered by a truly whole campus approach, then we need to break down silos and work systemically. And I think we can lead in that way too, where we're actually about harnessing that leadership potential of our students, developing them and indeed staff as active citizens and future leaders, decision makers and influencers, able to advocate and mediate for human and planetary health. Looking upstream, harnessing contributions that may not be explicitly labelled health, and seeking to address the connections between physical, mental, spiritual and social domains. I think we can raise our aspirations so that our strategic plans, campus design, operational management, research focus and curricular orientation simultaneously promote the positive well-being and thriving of both people and the earth that sustains us. I think a key role for the HEA, for DEFRIS and DOH, is to take every opportunity to collaboratively champion the Healthy Campus model as a core setting within Healthy Island's pursuit of healthy places, as an essential and evidence-informed approach to promoting holistic health, well-being and sustainability, and to enhancing student success and the core missions of higher education. I'd really urge government departments to work together to make sure that that broad approach is mandated or at least clearly incentivised, so that there is visible high-level leadership in HEIs, with the Healthy Campus being aligned with and articulated as the appropriate context for implementing more specific work linked to the National Student Mental Health and Suicide Prevention Framework.
So, well, traditionally the work of the university, I think, is centred primarily on educational outcomes for students, focusing on things like retention, progression. In recent years, particularly against the backdrop of COVID-19, the well-being of students has really become an integral part of conversations about student success. So we have a really important role to play in our institutions. And what that role is to create these supportive environments for students to thrive. Through the two frameworks that you see here, there remains a need to support all students and staff, to catch people upstream, as we've heard, and to holistically promote a healthy campus, as it were. Now, the Department of, and you're right to go with the acronym, Mark, the Ferris. The Department of Further and Higher Education, Research, Innovation and Science, you can see it rolls off my tongue, and the HEA, I don't know what that one stands for, have provided an additional €5 million per annum for student mental health and wellbeing support since 2020. I said health promotion is becoming a really important topic of conversation on university campuses, and it's really key to supporting students in their journey through higher education. However, there's also a responsibility to ensure that college campuses are settings that holistically promote health and well-being. In doing so, we can ensure that students are better placed to realise their potential. In turn, such an approach should offer relief to student health services and create a positive environment that builds resilience in our student population. Now, adequate and appropriate student support services remain important, and the increase of health centres and counselling services across Irish higher education institutions is vital to those students who need such help. Nonetheless, it is vital that work on health and well-being does not focus only on those in crisis. There remains a need to support all students and staff, to catch people upstream, as we've heard, and to holistically promote a healthy campus, as it were. But this funding is not a panacea and is intended to supplement, not displace, other resources. Various support, counselling and health services existed before this funding came online, and it is essential that HEIs remain committed to fulfilling the duty of care to their communities through adequate resourcing of these services. But perhaps now is the time to reflect and consider the role that universities have as providers of health services. Like I've said, there's a duty of care to students and staff. As a system, where does the best use of limited resources lie in order to ensure the best health and well-being outcomes for our campus communities? These are questions that we must ask and that we need to investigate further with the sector and with colleagues from other government agencies and departments.
75% of mental health difficulties that persist in adulthood have emerged before 25. What's really important? Sleep. And sleep hygiene. So we found, looking at what's recommended. It's recommended for this age, or for adults, to get between 7 and 9 hours sleep a night, which is recommended. 62% of students reported that they did get that required sleep. Here I have a slide linking sleep, recommended sleep, and depression. So the blue bars are those that are getting the recommended sleep. So you can see they're more likely to be in the normal range for depression and less likely to be in the very severe, versus those that aren't getting the recommended sleep. Sleep is really important. And those that have good sleep hygiene, this was linked to higher resilience. So those that came through a disability route, so they were more likely to report severe anxiety and severe depression versus those who were non-DARE. Diversity is an important part of our community, and we want diversity in our community, but if we have diversity, we have to be able to support our diversity, the diversity that comes into our community. I think it's really important that we take our data, what we have, and hang it back onto this and make sure it sits within a framework that we can actually evidence back to the HEA or wherever we want to go, who are funding our different initiatives. And I'm going to just summarise to say that young people live in complex, ever-changing worlds. We need to equip our students with the skills they need to navigate their way through difficult situations to achieve their potential. Let's not try and pathologise, let's put the right scaffolding in at the right time so that they can actually go on to achieve their potential.
Leadership and infrastructure is key to an awful lot of what we're talking about in terms of the whole university approach.
Without these skills, we are not sending out graduates into the workplace, into society. So we need to stop seeing these as lovely, nice, soft, fluffy add-ons, but see it as core business of the university. the top 10 skills from the World Economic Forum, we can see resilience, flexibility and agility, motivation and self-awareness, curiosity and lifelong learning. So this is our focus. This needs to be our focus.
So if we embed well-being into the curriculum, so that includes like self-awareness, awareness of other, empathy, like the previous speaker spoke about, sports, volunteering, societies, group work, peer-assisted learning. All of those things foster belonging, and we know that connection with others is the biggest predictor of mental well-being. So if we're going to be realistic about implementing Healthy Campus, it's going to take more resourcing, both for ourselves and also for academics.
In terms of the evidence base, we can see that skills-based interventions, so really the ones that are focused on the cognitive behavioural therapy, enhancing particular skill sets, they've been shown to be particularly effective in reducing symptoms of depression, anxiety, general psychological distress, and improving students' social and emotional skills.